Hello, and welcome to Module 4 of the Indian Child Welfare Act, or ICWA, Active Efforts Learning Series. This module covers the ICWA Active Efforts Support Tool, while illustrating how the child welfare workforce can use the tool to support American Indian and Alaskan Native families, known as AIAN families, affected by substance use. To facilitate this learning experience, we have gathered questions from state child welfare supervisors and workers specific to the content of this module. Let's start with a question about the ICWA Active Efforts Support Tool.
I understand there's a new tool to help me know if I'm meeting the active efforts standards. What is it?
Yes, the National Center on Substance Abuse and Child Welfare, in consultation with tribal experts at the Tribal Law and Policy Institute and Evergreen Training and Development, have created a new tool called the ICWA Active Efforts Support Tool, or IAST. The IAST is designed to help child welfare professionals provide active efforts to AIAN families affected by substance use. The tool provides guidance and recommendations on activities to prevent family separation when possible, while ensuring rapid, safe, and supported reunification efforts if court intervention occurs. Guidance takes place within the context of the 5 points of family intervention for infants with prenatal substance exposure and their families, which the Center for Children and Family Futures created.
Is it just for child welfare staff?
The IAST can also inform collaborative partners within healthcare, substance use treatment, home visiting, and community-based agencies, including those providing interpersonal violence and mental health services, about their critical role in helping child welfare provide active efforts when serving AIAN families affected by substance use. Active efforts, as discussed in Module 2, are one of ICWA's most critical components. ICWA came about in response to the alarming and disproportional rates of Native children in child welfare systems nationwide. According to the National Indian Child Welfare Association, 25 to 35% of all Native children were separated from their families and placed in foster homes, adoptive homes, or institutions. Worse, 85% of all Native children in foster care were placed in non-Native homes. Keep in mind, the legislative intent of ICWA was to, 1, reduce unnecessary removals of AIAN children by state agencies into dependency cases in state courts. 2, reduce the disproportionate rate of AIAN children in state dependency cases. 3, raise the quality of social work practice by state child welfare agencies. And 4, increase reunification rates for AIAN children and families.
What is the role of the family's tribe?
Tribal consultation is a necessary cornerstone under ICWA and is essential in reaching positive case outcomes. Regular tribal consultation will strengthen active efforts since tribal agencies remain key sources of information regarding AIAN families affected by substance use. The tribe can help identify relatives, engage parents, and highlight local and culturally competent services for the family. Tribal consultation requires an exchange of information and the sharing of professional opinions to reach a better understanding before critical case decisions that affect family integrity take place. See Appendix A of the IAST for additional information on how to provide active efforts within the context of tribal traditions and customs. The level of involvement different tribes maintain in cases varies due to dramatic differences in their level of resources. Lack of involvement or availability for consultation typically results from resource shortages and limited staff. A lack of involvement or availability should not be interpreted as a lack of interest in the case and does not imply that ICWA's mandates no longer apply. ICWA's efforts and mandates in these situations are not contingent upon the involvement of the tribe.
I've heard different terms used for plans when the family is AIAN. Can you explain?
Yes, terminology can be confusing and specific to each state. Although we use the term Family Wellness Plan in this tool, please explore how your own jurisdictions name and implement prenatal and postpartum plans for individuals affected by substance use. The 3 most common options are 1, Plan of Safe Care, This is the term used for the plans state agencies create per the requirements in the Child Abuse Prevention and Treatment Act, or CAPTA. Child welfare agencies most often develop these plans. 2. Family care plans. While plan of safe care is the term used in CAPTA legislation, some jurisdictions use the term family care plan locally to delineate prenatal or community health support plans for pregnant or postpartum individuals. 3. Family wellness plans. Children and Family Futures Tribal Family Wellness Plan learning modules, and some tribes use Family Wellness Plan. We use state agency for the office seeking removal of a child into custody or with current custody of the child. ICWA puts the active efforts obligation and responsibility on state agencies. ICWA does not put this obligation or responsibility on tribes or tribal programs. Despite ICWA's mandate for active efforts, follow-through remains a problem nationwide. National studies have found active efforts documented in only 66% of case records, 67% of pretrial or adjudication hearings, and just 21% of disposition hearings.
How will this tool help me do my job?
The IAST can support your work in many ways. You'll find multiple examples of active efforts within this tool. These active efforts are organized through the lens of the 5 points of family intervention, discussed more thoroughly in Module 2. This process differs from standard practice, where most child welfare agencies wait to intervene until the birth of an infant with prenatal substance exposure. Services offered during the prenatal period can demonstrate active efforts and may, in some cases, prevent family separation and dependency court involvement. For those families who still need to come before a dependency or tribal court, a prenatal family wellness plan may demonstrate sincere and sustained active efforts to avoid AIA and family separation. Frontline child welfare staff will ideally complete this tool and review it monthly with their direct supervisor. The goal is to monitor whether prevention and reunification services provided to AIA and families affected by substance use meet the criteria of active efforts, as required by ICWA. This tool clarifies activities that would and would not satisfy the active efforts standard for caseworkers, and provides resources for supervisors to guide and coach the caseworker. Frontline child welfare staff, when using this tool, can review each of the recommended active efforts and indicate whether they have implemented each one. If they answer no, the worker can proceed to the follow-up steps to indicate the barrier, the potential solution, who is responsible, and the timetable for implementing the solution. This tool can also support child welfare supervisors who can review implemented active efforts and strategize with their frontline staff on overcoming barriers. The ICWA Active Efforts Support Tool serves to prevent family separation when possible, while ensuring rapid, safe, and supported family reunification efforts if courts intervene. Partner agencies can understand their roles and responsibilities when working with child welfare to ensure clients receive active efforts. The National Center on Substance Abuse and Child Welfare has a host of materials and information to further expand your knowledge base related to families affected by substance use. Please visit ncsacw.acf.hhs.gov for more information. Also, please visit the Capacity Building Center for Tribes at tribalinformationexchange.org for more resources aimed at nurturing the safety, permanency, and well-being of American Indian and Alaska Native children, youth, and families.